The respiratory system is a biological system in the body that enables breathing and the exchange of gases. The primary components of the respiratory system include the nose, pharynx, larynx, trachea, bronchi, and lungs. It consists of a series of organs and structures that facilitate the intake of oxygen from the air and the removal of carbon dioxide from the bloodstream. What is the function of hemoglobin in the respiratory system? A. Regulate breathing rate. B. Transport oxygen. C. Produce mucus. D. Filter air. Rationale. Hemoglobin is a protein in red blood cells responsible for transporting oxygen from the lungs to the tissues and returning carbon dioxide from the tissues to the lungs. Which respiratory condition is a genetic disorder that affects mucus production? A. Asthma. B. Chronic obstructive pulmonary disease, COPD. C. Cystic fibrosis. D. Bronchitis. Rationale. Cystic fibrosis is a genetic disorder that leads to the production of thick, sticky mucus that can clog airways and lead to respiratory and digestive problems. What is the normal respiratory rate for a healthy adult at rest? A. 6 to 12 breaths per minute. B. 12 to 20 breaths per minute. C. 20 to 30 breaths per minute. D. 30 to 40 breaths per minute. Rationale. The normal respiratory rate for a healthy adult at rest is typically between 12 and 20 breaths per minute. What is the primary cause of chronic obstructive pulmonary disease, COPD? A. Genetic factors. B. Bacterial infections. C. Smoking. D. Viral infections. Rationale. Smoking is the leading cause of chronic obstructive pulmonary disease, COPD, which includes chronic bronchitis and emphysema, due to the harmful effects of tobacco smoke on lung tissue. Which of the following is not a part of the lower respiratory tract? A. Larynx. B. Trachea. C. Bronchi. D. Alveoli. Rationale. The larynx is part of the upper respiratory tract, while the trachea, bronchi, and alveoli are components of the lower respiratory tract. What is the main purpose of the nasal cavity? A. Warm and moisten air. B. Produce mucus. C. Generate sound. D. Absorb oxygen. Rationale. The nasal cavity warms, moistens, and filters the air we breathe, preparing it for entry into the lower respiratory tract. Which structure in the respiratory system is commonly referred to as the voice box? A. Pharynx. B. Larynx. C. Trachea. D. Bronchus. Rationale. The larynx, also known as the voice box, contains the vocal cords and is involved in sound production as well as protecting the trachea during swallowing. Which of the following is not a symptom of asthma? A. Wheezing. B. Shortness of breath. C. Chest tightness. D. High blood pressure. Rationale. Asthma symptoms include wheezing, shortness of breath, and chest tightness, but high blood pressure is not directly related to asthma. What is the function of the epiglottis during swallowing? A. Produces sound. B. Traps particles. C. Prevents food from entering the trachea. D. Filters air. Rationale. The epiglottis covers the trachea during swallowing, preventing food and liquids from entering the airway and directing them into the esophagus. Which gas is the primary stimulus for breathing? A. Oxygen. B. Nitrogen. C. Carbon dioxide. D. Hydrogen. Rationale. The primary stimulus for breathing is the level of carbon dioxide in the blood. High carbon dioxide levels trigger an increase in the breathing rate to expel excess CO2. What is the medical term for a collapsed lung? A. Pneumothorax. B. Pneumonia. C. Pleural effusion. D. Bronchiectasis. Rationale. Pneumothorax refers to a collapsed lung, which occurs when air leaks into the space between the lung and chest wall, causing the lung to collapse. Which structure serves as the site of gas exchange in the lungs? A. Bronchioles. B. Trachea. C. Alveoli. D. Pleura. Rationale. Alveoli are the tiny air sacs in the lungs where gas exchange occurs, allowing oxygen to enter the blood and carbon dioxide to be expelled. Which respiratory disorder involves the destruction of the alveoli and loss of lung elasticity? A. Asthma. B. Chronic bronchitis. C. Emphysema. D. Tuberculosis. Rationale. Emphysema is a form of COPD characterized by the destruction of alveoli, resulting in reduced surface area for gas exchange and decreased lung elasticity. What is the role of the intercostal muscles in breathing? A. Produce mucus. B. Filter air. C. Support lung expansion and contraction. D. Generate sound. Rationale. The intercostal muscles, located between the ribs, assist in expanding and contracting the chest cavity during breathing, aiding in the inhalation and exhalation process. Which term describes the maximum amount of air that can be exhaled after a maximum inhalation? A. Tidal volume. B. Vital capacity. C. Residual volume. D. Expiratory reserve volume. Rationale. Vital capacity is the maximum amount of air that can be exhaled after a maximum inhalation, indicating the capacity of the lungs to hold and expel air. What is the primary component of cigarette smoke that contributes to respiratory disease? A. Nicotine. B. Carbon monoxide. C. Tar. D. Formaldehyde. Rationale. Tar in cigarette smoke is a sticky substance that coats the lungs and airways, contributing to respiratory diseases like chronic bronchitis, emphysema, and lung cancer. Which diagnostic tool measures the oxygen saturation level in the blood? A. Spirometer. B. Sphygmomanometer. C. Pulse oximeter. D. Electrocardiogram. Rationale. A pulse oximeter is a non-invasive device used to measure the oxygen saturation level in the blood, providing an indication of respiratory efficiency. What condition is characterized by an infection that inflames the air sacs in one or both lungs? A. Bronchitis. B. Emphysema. C. Pneumonia. D. Asthma. Rationale. Pneumonia is an infection that inflames the air sacs in one or both lungs, causing them to fill with fluid or pus and leading to symptoms such as coughing, fever, and difficulty breathing. What is the term for the volume of air inhaled or exhaled in a normal breath? A. Tidal volume. B. Residual volume. C. Vital capacity. D. Inspiratory reserve volume. Rationale. Tidal volume is the volume of air inhaled or exhaled in a normal, unforced breath, typically around 500 milliliters in a healthy adult. Which condition is characterized by the constriction and inflammation of airways, often triggered by allergens or stress? A. Tuberculosis. B. Bronchitis. C. Asthma. D. COPD. Rationale. Asthma is a chronic respiratory condition characterized by airway constriction and inflammation, often triggered by allergens, physical activity, or stress, leading to difficulty breathing and wheezing.